Welcome to TelehealthFX Talk. Today's episode is one that has been requested constantly, and it's a topic that is deeply personal for millions of women. We're talking about berberine for PCOS, Polycystic Ovary Syndrome. If you have PCOS, you know how frustrating it is. You're fighting weight gain that doesn't respond to normal diets, dealing with acne, unwanted hair growth, irregular periods, and you feel like your body is working against you at every turn. Today, we're going to break down what the research actually says about berberine for PCOS, how it compares to metformin, and what a complete management plan looks like. And if you're looking for a clinical team that offers berberine alongside GLP-1 medications and other treatments, visit TelehealthFX.com. That's TelehealthFX.com. They'll help you find the right approach for your specific situation.
Before we get into berberine, I want to make sure everyone understands what PCOS actually is, because it's way more common than people realize and way more underdiagnosed. PCOS is a chronic endocrine and metabolic disorder. The World Health Organization estimates it affects about 10 to 13% of women of reproductive age globally. But here's the staggering part. Up to 70 to 75% of women with PCOS are undiagnosed. That means the majority of women who have this condition don't even know they have it.
And the symptoms are varied, which is part of why it gets missed. The most common symptom is menstrual irregularity, irregular periods, infrequent periods, or absent periods entirely. Then there's hyperandrogenism, which is excess androgen hormones, and that shows up as acne, unwanted facial or body hair, and thinning hair on the scalp, weight gain, especially around the midsection, fatigue, anxiety, and depression, and for many women, difficulty getting pregnant.
But what's really important to understand is the metabolic engine driving all of this. At the core of PCOS for most women is insulin resistance, and this creates a vicious cycle. When your cells become resistant to insulin, your pancreas pumps out more and more insulin to compensate. That excess insulin does two terrible things. First, it stimulates your ovaries to produce excess androgens, the male-type hormones that cause the acne, the hair growth, and the menstrual disruption. Second, it reduces something called SHBG, sex hormone binding globulin, which means more free testosterone circulating in your blood. And then the excess androgens promote visceral fat storage, and visceral fat makes insulin resistance worse. It's a cycle that feeds itself.
Which is exactly why addressing insulin resistance is the single most important intervention for most women with PCOS. And this is where berberine enters the picture. Let's go through what the research actually shows. First, insulin sensitivity and blood sugar. Multiple clinical trials and meta-analyses confirm that berberine improves insulin sensitivity and lowers fasting blood sugar in women with PCOS. It works through AMPK activation, which we covered in detail in our berberine versus GLP-1 episode. In terms of effectiveness, studies have found it comparable to metformin for these specific markers. Second, androgen reduction. A meta-analysis of randomized controlled trials found that berberine significantly reduces total testosterone levels and improves the LH to FSH ratio, which is a key hormonal marker that's disrupted in PCOS. This means berberine may directly help with the symptoms that affect daily life, the acne, the excess hair growth, and the hormonal imbalance. Third, weight and body composition. Berberine is associated with modest reductions in weight, BMI, and waist circumference. Now, I want to be honest here. These are modest effects. Berberine is not going to produce the dramatic weight loss that GLP-1 medications like semaglutide produce. But for women with PCOS, where even a 5 to 10% weight loss can significantly improve symptoms, those modest reductions can be clinically meaningful, especially when paired with lifestyle interventions. Fourth, menstrual regularity. Some studies show berberine can help restore regular menstrual cycles and improve ovulation rates in women who aren't ovulating. However, and this is important, the evidence on fertility outcomes, actual pregnancy rates, and live births is still limited and mixed. So if fertility is your primary goal, this is a conversation to have with your reproductive health provider. And fifth, lipid profiles. Berberine may lower LDL cholesterol and triglycerides while increasing HDL cholesterol. Some studies actually show more favorable lipid effects than metformin, which is interesting given that cardiovascular risk is elevated in women with PCOS. Now let's compare berberine to metformin directly, because a lot of women want to know how they stack up. Metformin is the established first-line pharmaceutical treatment. It's FDA approved, it's a prescription medication, and has decades of robust clinical data behind it. Berberine is an over-the-counter supplement with an emerging but smaller evidence base. In terms of insulin sensitivity and androgen reduction, studies show them performing comparably. Where metformin has the clear advantage is in the strength of the evidence, the consistency of manufacturing, and especially in fertility and pregnancy data. If you're trying to conceive, metformin has extensive safety data. Berberine does not have sufficient pregnancy safety data, and the standard recommendation is to discontinue berberine when you're trying to get pregnant or as soon as you confirm pregnancy. That's a critical distinction. And where berberine has an advantage for some women is tolerability. A lot of women can't tolerate metformin because of the gastrointestinal side effects, the nausea, the diarrhea, the stomach cramps. Some women find that berberine, especially dihydroberberine, which has up to 5 times better absorption, gives them similar metabolic benefits with fewer GI issues at lower doses. In terms of dosage, the most commonly studied dose for PCOS is 500 milligrams, taken 2 to 3 times daily with meals. Taking it with food improves absorption and reduces any stomach upset. If you're interested in dihydroberberine, the dosing is lower, usually 100 to 300 milligrams per day because of the improved bioavailability. Now here's something I need everyone to hear. If you are currently taking metformin or any other blood sugar medication, do not add berberine on your own. Berberine lowers blood sugar. Metformin lowers blood sugar. Combining them without medical supervision can cause dangerous hypoglycemia. Berberine also interacts with many other medications because it inhibits certain liver enzymes. Always work with a healthcare provider before starting berberine. And this is exactly why platforms like TelehealthFX exist. They offer berberine as part of their clinical platform alongside GLP-1 medications like semaglutide and tirzepatide. Their providers can evaluate whether berberine is the right fit for your PCOS management, whether you'd benefit more from a GLP-1 medication, or whether a combination approach makes sense. You get 24-hour provider review, one-on-one onboarding support, transparent pricing with no hidden membership fees, and they're licensed in all 50 states with 2-day UPS shipping. They also offer NAD+ therapy and Sermorelin. Visit TelehealthFX.com. That's TelehealthFX.com. Let me also lay out what a complete PCOS management framework looks like, because berberine alone isn't enough. First, address insulin resistance with berberine, metformin, or in some cases a GLP-1 medication, based on your provider's recommendation. Second, prioritize protein, 25 to 30 grams per meal, to stabilize blood sugar and support lean mass. Third, resistance training 2 to 3 times a week. This is critical for improving insulin sensitivity and supporting metabolic health. Fourth, manage stress and prioritize sleep, because cortisol and sleep disruption both worsen insulin resistance. And fifth, work with a clinical team that understands PCOS isn't just a cosmetic condition. It's a metabolic condition that requires metabolic treatment. That last point is so important. Too many women are told PCOS is just about irregular periods or acne. It's not. It's a systemic metabolic disorder, and treating it effectively means addressing the insulin resistance at the root. Perfectly said. If you have PCOS and you're ready to explore whether berberine, GLP-1 medication, or a comprehensive approach is right for you, visit TelehealthFX.com. That's TelehealthFX.com. Take the free qualification quiz, connect with a licensed provider who understands metabolic health, and start getting the clinical support you deserve. Transparent pricing, no hidden fees, real answers. And as always, everything on TelehealthFX Talk is for educational purposes only. This is not medical advice. PCOS is a complex condition, and your management plan should be developed with your healthcare provider based on your individual situation. If you suspect you have PCOS, please seek a proper diagnosis. Do not start or stop any medication or supplement with guidance from your clinician. Individual results vary. Thank you for listening. If this episode helped you understand berberine's role in PCOS management, share it with every woman in your life who's dealing with this condition. We'll see you next time on TelehealthFX Talk.